St. Lucia joins the global community in observing the 36th World AIDS Day on December 1st, 2024. This year's theme, Take the Right Path, underscores the vital importance of human rights in addressing HIV and AIDS. Since the onset of the AIDS epidemic 43 years ago, the Joint United Nations Program on HIV, AIDS, UNAIDS estimates that 78 million people worldwide have been infected with HIV, and 35 million have died from AIDS-related illnesses. In St. Lucia, this day serves as a somber reminder of those we have lost while reinforcing efforts to end AIDS as a public health threat by 2030. Ministry of Health, Wellness and Elderly Affairs Senior Medical Officer Dr. Gail Gajada expresses optimism for the future.
According to UNAIDS, the world can end AIDS if everyone's rights are protected. With human rights at the center and communities in the lead, the world can end AIDS as a public health threat by 2030.
Respect for human rights is crucial in curbing the spread of HIV and addressing the associated stigma. Under international human rights laws, including the Universal Declaration of Human Rights, every individual has the right to health and access to medical care. However, stigma and discrimination against those living with HIV continue to violate these rights and exacerbate the epidemic's impact.
Many people continue to face human rights-related barriers to essential HIV and other healthcare services. The persons facing those barriers are often the most marginalized, stigmatized, and vulnerable to HIV. Therefore, the protection, promotion, respect, and fulfillment of people's human rights are critical to guarantee access to HIV services and enable a continued and effective response to the HIV epidemic.
St. Lucia has been a member of the United Nations General Assembly since 1979 and adheres to the principles outlined in the Universal Declaration of Human Rights. Article 12 emphasizes the right to confidentiality, while Article 16 acknowledges everyone's right to marry and start a family.
All persons living with HIV have the right to have children, and in St. Lucia, medication is available that women living with HIV who are pregnant can take to reduce the risk of transmitting the virus to their unborn child. Another basic human right is the right to treatment, and Article 25(1) states that everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care and necessary social services.
St. Lucia provides comprehensive treatment and support for individuals living with HIV, including access to antiretroviral therapy and medications for opportunistic infections. However, significant challenges remain. Currently, there are just under 1,000 diagnosed cases of HIV in St. Lucia, yet only 284 individuals are actively collecting their antiretroviral medication. This reveals a gap in treatment adherence and highlights the urgent need for enhanced outreach and support systems.
There are persons who are undiagnosed and thus unaware of their HIV status. And anyone who is sexually active and is at risk for contracting HIV and other sexually transmitted infections.
In 2023, the country recorded 16 AIDS-related deaths, serving as a stark reminder of the ongoing threat posed by the disease. Chloe Dantes, NBC Prime.